name is Supie Johnson. I am the Information Services Manager at MultiCare. I started working here April of 2012. I would say information services encompasses a variety of IT services. It's not your typical what you would expect as far as just network and development. The breadth of it is into clinical informatics and information intelligence, which is kind of like your business intelligence type warehouses in non-clinical settings. And some of your other IT functions such as the service desk, desktop support, clinical engineering. So those are the folks that are supporting all those biomedical devices and the vents and monitors, those types of things on the floor. The people that report to me are interface engineers. So the types of skills I'm looking for is that they're innovative, that they have business and technical and analysis skills so that they can do effective impact analysis. I'm also looking for them to have the ability to develop IT solutions, because a lot of times we will have a request given to us and we don't have it given to us in a way that it's already roadmap out. So we have to really develop what that roadmap is going to look like and how it's going to be value added for the customer. This kind of person also has to be excited about technology. We are in a great time in healthcare, so we're undergoing a lot of change, and it's very dependent on some of the technology and solutions that it's going to bring forth to help with the change be more palatable. Challenges: developing scalable solutions. It's easy to get in a firefighting mode just to put a quick fix on the issue and move on. That's not good enough. So that's just a workaround. We need to go back, develop a proactive way to prevent that problem from occurring in the future, and make sure that we're checking back. Is that still good? Is there a better way? What else can we do to make things better? Ensuring that our solutions are value added for our internal and external customers that provide patient care. So we don't want to develop things that are going to take away the care that's being provided to the patient by adding additional steps for that person at the bedside. So our solutions should make their jobs easier, so in turn it'll make the service that the patient receives better. In information services, as far as the typical day goes, there is no such thing as a typical day. Every day is different, and that is what really keeps people here for a long time. That's why they go other places and they come back, because they don't have that change every day and the challenges that it brings. The types of schedules that are available within information services will vary on the role and what the job requires. Some of them are straight Monday through Friday, business hour type jobs, and others may be 24/7 or different shifts. Working in information services definitely requires a high degree of collaboration. You are interacting not only with people amongst the IS division, but outside of information services as well. So you can be interacting with a physician, you can be interacting with someone in nutrition services, you can be interacting with a technologist. It just varies, and you're also interacting with vendors. So we are supposed to operate as one unit and a common goal to serve our patients. So that collaboration is key to make that success. I think there's kind of two parts to the personal and professional growth that MultiCare offers. So for example, personal growth, the leadership team is very supportive of development of their employees and healthy employees. So we have programs that are available to improve the health of our employees and some incentives around that. We also have options for training and development of skills while you're here. You also have the exposure to people that are more senior in technical roles, so there will be mentoring opportunities for growth. The personal and professional development I see is that you are being invested in as a person. So whatever you gain professionally can also transfer into your personal life for improvement as well. My opinion for why someone should come and work for MultiCare, especially in an IT role, is that nowhere in other IT industries are you really going to see how your work improves people's lives. The impact that has is amazing. And you're not going to get that if you're just developing software for a service somewhere else. Another reason why people should really consider MultiCare as their employer of choice is that you as an employee are valued as a person. You're not perceived as an asset. The amount of care you get is system-wide. There are people that are willing to have your back that aren't even a part of your team or your department.